There is a moment, a fraction of a second that changes everything. A bullet travels from barrel to skull in 0.0003 seconds, faster than your brain can even process the sound of the shot, faster than pain. And yet, some people survive it, not just survive, wake up, speak, remember their children's names. Why? What actually happens inside that skull in those 0.0003 seconds, and in the days, weeks, and years that follow? That's what we're going to find out. First, the physics. Because what a bullet does to a human skull is not what most people think. Most people imagine a bullet as something that punches a clean hole through tissue. Neat. Direct. Like in movies. That is almost never what happens. A bullet entering the skull creates what's called a temporary cavity, a shockwave that expands outward in all directions, stretching and compressing tissue in a radius far beyond the bullet's actual path. The brain, which is roughly the consistency of firm jelly, gets pushed, twisted, and compressed by this wave. Even tissue the bullet never directly touches can be destroyed. Then there's the permanent wound channel, the actual path of destruction left as the bullet travels. Add bone fragments acting as secondary projectiles inside the skull, and you start to understand why head wounds are so catastrophic. It's not just the bullet, it's the energy it transfers. A high-velocity rifle round transfers exponentially more energy than a low-velocity handgun round. Same size hole, completely different destruction. Now, what does the person inside that skull actually experience? The answer will surprise you. In the immediate moment of impact, most survivors report feeling nothing. No pain, no flash of light, no cinematic slow motion. For many, consciousness simply switches off like a light going out. Phineas Gage, the most famous head injury case in all of neuroscience, had a 3-foot iron rod blown completely through his skull in 1848. He didn't lose consciousness. He sat up, he spoke to the men around him, he walked to the cart that carried him to the doctor. The brain, in certain types of trauma, simply doesn't register the damage immediately. The frontal lobe, right behind your forehead, governs personality, decision-making, impulse control. Gage's frontal lobe was destroyed. The man who survived was, by every account of his friends and family, a completely different person. Same body, same memories, different soul. The bullet didn't kill him. It changed who he was. But Phineas Gage is not alone. In 2011, U.S. Congresswoman Gabrielle Giffords was shot through the left hemisphere of her brain at a public event in Arizona. The bullet entered her left hemisphere, the side responsible for language and speech. She woke from her coma, unable to speak properly, a condition called aphasia, where the words are there in your mind, but the pathway to say them is damaged. Through years of intensive therapy, she relearned language, painstakingly, word by word, not because the damage healed, because her brain physically rewired itself around the damage. That process is called neuroplasticity, and it is one of the most extraordinary things the human brain does. In 2012, 15-year-old Malala Yousafzai was shot in the head on a school bus in Pakistan. The bullet entered near her eye, traveled along her skull, and lodged in her shoulder. She survived largely because of trajectory. The bullet skirted the outer surface of the brain rather than penetrating deep tissue. A few degrees in any direction and she doesn't survive. She was flown to the UK, underwent multiple surgeries, and 10 months later, she stood before the United Nations. But for every Giffords, for every Malala, there are thousands of survivors whose names we never know, who spend years relearning how to tie their shoes, how to recognize their wife's face, how to feel joy again. So what determines survival? Why does one person walk away and another doesn't? Location is everything. A bullet through the brainstem, the base of your skull, where your brain meets your spine, is almost always immediately fatal. The brainstem controls your heartbeat, your breathing. Damage it, and those functions stop. A bullet through the frontal lobe, survivable. Life-altering, but survivable. Through the temporal or parietal regions, outcomes vary enormously depending on exactly which structures are hit. Then bullet type. A low-velocity handgun round fired from a distance causes dramatically less cavitation than a high-velocity rifle round at close range. Same entry wound, completely different internal destruction. Time to treatment. The brain begins dying within 4 to 6 minutes of losing blood supply. Every minute without intervention is permanent damage that cannot be undone. And then there is luck, the precise angle of entry, whether the bullet tumbles inside the skull or travels cleanly, whether it hits a blood vessel or misses it by a millimeter. Medicine can optimize everything else. But trajectory, that is simply luck. People talk about surviving a gunshot wound to the head as if survival is the finish line. It isn't. It's the starting line of a different race entirely. Survivors face swelling of the brain in the first 72 hours, often more dangerous than the initial injury. Infection. The skull is not sterile. A penetrating wound introduces bacteria directly into brain tissue. Seizures, which can begin days, weeks, or even years after the injury. Personality changes, memory loss, emotional dysregulation, depression, and often the hardest part, waking up and not recognizing who you are anymore. Survivors frequently describe meeting a version of themselves they don't know. Someone who laughs at different things, who gets angry at nothing, who can't find words they used every day for 30 years. Recovery is not healing in the traditional sense. The damaged tissue doesn't grow back, it is rerouting. The brain finding new pathways around destroyed ones, like a road crew building a bypass around a collapsed bridge. It is slow, it is painful, and it never fully stops. Because the brain never fully stops adapting, every person who has survived a gunshot wound to the head has taught us something irreplaceable. Phineas Gage taught us that personality lives in the frontal lobe. Giffords taught us that language can be rebuilt from almost nothing. Thousands of veterans returning from Iraq and Afghanistan taught us that traumatic brain injury is invisible, that you can look completely fine and be fundamentally broken inside. And all of them, together, have driven the most rapid advances in neuroscience and brain surgery in human history, from crude trepanation to real-time brain mapping in 200 years. The brain is still the final frontier. We understand less than 10% of how it works, and every injury, every tragedy is in the hands of scientists and surgeons a map of what each region does, what it connects to, what the brain cannot live without, and what it can quietly learn to live without. I want to leave you with something one survivor said. A man named Ian, shot through the right hemisphere in a robbery in 2004, described waking up in hospital like this. It wasn't like coming back from somewhere. It was more like the world had been rebuilt around me while I was gone. Everything looked the same. Nothing felt the same. The world had been rebuilt around him, and he had to rebuild himself inside it. That is what the brain does. Not gracefully, not quickly, not completely, but it tries. Links below, like sources, survivor accounts, and the neuroscience research referenced throughout this video. If this is the kind of content that makes you think, subscribe. There's more coming.